It's still Lifelines with Mima, and we're treating the issue of infertility today. With us in the house, we have two special consultants, Dr. Diego and Dr. Sazua. I also have my crew, and it's about to go down. Welcome, guys.
Thank you, Mima.
Yeah.
Does multiple abortion make a woman infertile?
That we discussed a bit about it. A lot of the pressures on the woman, but termination of pregnancy can also trigger issues that can lead to infertility. The reason is one, like we said earlier, it can get infected, can damage the tubes, can damage the endometrium where the baby stays. Then the instrumentation itself can damage the lining where the baby stays. Can also affect the neck of the womb, can become tight. So multiple abortions can be a risk factor for subsequent infertility.
Especially when it's not done well.
It's not done
Yes,
properly.
because we see situations where you may have had like 20 abortions, and when you marry, you have a set of twins. So it's about how it is being done. Safe abortion is what is being advocated by some people. Especially when you have to terminate a pregnancy, make sure you go to the right place.
To do it.
Someone that has the experience and is able to do without you having any complications, which will include antibiotics use, and make sure that the instruments are sterilized. Those little things are very, very important, because once you do that, there shouldn't be any problem.
Our law is restrictive. Our law does not allow abortions only for certain situations. Congenital malformation, pregnancy poses a risk to the woman. So a lot of the abortions we do, they are classed as criminal abortions, where the doctor can go to jail for up to 7 to 14 years.
Thank you, sir. Thank you for saying that.
Because of that, a lot of the abortions are done as
clandestine.
Yes,
So are you saying it's better the lady or the victim takes...
no, what the advice we give is take motherhood very seriously. Don't play with pregnancy, because the woman is the person that harbors a lot of the consequences later. The man often will not harbor a lot of the consequences. So by the time you should, getting pregnant should be something that you take very seriously. You don't toy with it.
You don't.
Exactly.
It's not something you just do.
Yes.
So termination should not be a therapeutic. You should not see termination as a solution.
You can just get pregnant and remove it, no
No,
problem.
it's not.
At any time.
I can advise you and say that is not the right way to go.
Yeah.
And let me just add to it, there's what we call biosocial gap. The period between the time you start having sex and when you get married. For some people, it's up to 15 years or even 20. So, and you may probably have dated a lot of men along the line. Some you dated for a long time, some for short periods. No condoms were not used at a point. So there may have been some transfer of certain organisms. And these infections are subtle. You may not really have any symptoms. Then they gradually damage certain parts of the reproductive system, especially the fallopian tubes. So when it's now time for you to have a baby, there may now be some difficulty from contraception to conception. There are problems.
So because it's criminal most times, I like to go and do it in a place where you won't do it properly.
And that's where the problem comes.
Yes, that's where the problem comes. And for them, we just...
Okay, Osas, let's have your own question.
You also should speak to yourself. It's not true you can hear. I'm telling you.
All those girls.
Am I pregnant? I don't understand. Because I'm very happy that you brought doctors here, and I'm specifically happy you brought a doctor from my place, because I know he will tell me the truth.
Okay.
I'm not saying you will lie, doctor. But I know if he doesn't tell me the truth, we know where to meet.
In the village.
If I go to the Oba of Benin, I know how to sort it out. Yeah, so I'm excited. This infertility issue, doctor, I can call you Dr. Ipa because you are from my place, it's very, very sensitive, especially when you come to the area where we are from. I found out that people are now clamoring that they are fertile. And you don't know how fertile land is without treading on that land, without planting things there. I told them, Nuna, let me talk.
I'll be back here.
Please, doctors are here. Doctors are here. Mima, talk to them.
Okay. Are you saying that it's you have to test?
That's what he's saying.
Let me
this
is the problem I'm always having.
Okay.
Now they know when visitor theirs. Don't tell me don't do.
Okay. Okay.
Visitors are around. Calm down. Let me talk.
We are talking.
Sorry, sirs. Now, so that's the problem. So, you know, I am of the opinion that all this fertility, whatever, for you to know, you have to farm on that land. You see, Pa is laughing. That means it's important I'm saying. Whether premarital or marital sex is sex, you have to tread on it because I don't believe there's any other way you can test fertility. I cannot go and put myself inside bondage. After I don't try and finish, they say no divorce because I'm a Christian. Do you understand? And I don't support divorce. So I believe that the only way to know the fertility level is to
check it.
Forget it. Yes, check it. All of them that are from here, I know they don't check themselves. You have checked yourself before.
Let me give you, you know, we're trying to share opinions. We are sitting here as experts. I think the truth is, like we said earlier, when you have a couple, it can be a bit difficult. Like if you go to the hospital now, say you want to test your fertility potential, they will do a sperm test for you. Even if they say it's normal, pregnancy is still the best test of your fertility potential. So that's why you see that most people are normal. So you don't have enough foundation to say you want to go and start.
Check.
Because you now fall into the trap of the first question, where you now have to start doing abortions as a form of therapy, which is unacceptable. You understand? So for you, what our advice is that for you, you don't have any grounds to test. Let me explain why. It's just like saying that you were born and you were rated as normal. You grew up as a child. You went to primary school. You went to secondary school. You've lived your life and normality has encircled you. So now you've gotten to the stage where you have to get married. You don't need to bother about normality again. You don't need to now start creating issues to resolve it. All you need to do is to now get married
and try
and carry on.
This is television trick that you're using. But this is wait, let me talk.
Also, you're not sure you're potent.
I'm very potent. If you want, let's go outside. Please leave that one. You have been eyeing me since. You have been eyeing me since. Well, doctor, you have dealt with that issue so that I don't, because like I said, I believe you, but I'm still not satisfied. Maybe me and you will see after the show. So that you educate me more. So now there's another thing. Your mouth are sharp now. I want to eat them now. There's another thing that these women have been doing. Posting to contrast that they are taking. Listen. Posting they're posting on now. This one I don't want to speak. Yes. Whatever is the twat. You know see, she knows. That they are using. Even the way the names are two, all of them. Buy these things. Please tell them.
Postinol is a contraceptive method. It's referred to as an emergency contraception. What you use when intercourse is unplanned. It's unplanned. But we need to appreciate the pros and cons. Why it's widely used is also not a very safe method.
Good.
The failure rates are high during your ovulation periods.
All right.
Can also disturb your periods.
They don't even know the ovulation period.
They can also disturb your menstrual cycle. They can delay it and create a sense of pregnancy, which can create a lot of psychological reaction.
Abortion is better than taking
No, we're not saying that.
Why do you like abortion?
We're not saying.
You see, I think the message which you take away from here is that abortion is something that you should move away from. I think that's what.
Embrace postnol 2.
We're not saying embrace postnol 2. What we're saying is, I think the message we need to cut across is that sexuality is also something you should treasure.
It's a serious thing.
Because that's where a lot of these issues are coming from. We don't treasure sexuality
at all.
We're trying to manage the consequence of it, which is not creating a lot of the problems. If you treasure sexuality, you see that a lot of all these things you won't have need for them.
Yeah,
exactly.
I have a lot of clients who are pregnant. Their pregnancy is ongoing. They use Postinol. It didn't work.
Okay.
So that's why I think the lesson from here is every woman should appreciate the fact that sexuality has a consequence. So if you're not careful, it can be negative and it can come up years later.
How many of you still value your sexuality these days? They don't value it. That's the problem we are having. You don't value it. It's showing in your eye where you don't tell her now.